This brief video will provide an introduction to the therapeutics of pain. First, I will introduce the primary pharmacologic classes of drugs used to treat pain and various pain syndromes. Several of these pharmacologic classes are already reviewed for you, and so I'll provide some resources to review the mechanisms of those agents. Let me quickly remind you of the four stages of pain processing: transduction, transmission, perception, and modulation. At the transduction stage, there are several chemical mediators that are released at the site of damage. A few drug classes, including NSAIDs, aspirin, and acetaminophen, are effective in reducing the activity at this stage of pain processing. In the transmission, perception, and modulation stages, several drug classes exist to modify the activity of neurons in these stages, including the opioids, antidepressants, and anti-epileptic or anticonvulsant drugs. Another way to think about pain therapeutics is to distinguish between classes of drugs that are used to treat nociceptive pain and those that are used to treat neuropathic pain. For nociceptive pain, the primary drug classes used to treat this type of pain are aspirin, acetaminophen, NSAIDs, and opioids. For neuropathic pain, the primary drug classes that have efficacy here are antidepressants and antiepileptics. The non-opioid analgesics that have efficacy in the treatment of pain include aspirin, acetaminophen, ibuprofen, ketorolac, and celecoxib as examples, although there are, of course, many others that fall into the NSAID drug class. The mechanism of these drugs is review from your P1 year. There exist several different drug classes to treat neuropathic pain, including antidepressants, antiepileptics, as well as topical formulations of lidocaine and capsaicin. Let's start in the center of this table with the antiepileptics. The antiepileptic or anticonvulsant drugs should be a review from just a few weeks ago, and specifically drugs including gabapentin, extended-release gabapentin, and pregabalin all have efficacy in the treatment of neuropathic pain. As a reminder, these drugs all act on the alpha-2 delta subunit of voltage-gated calcium channels, which decrease central sensitization. Several antidepressant drugs are also useful in the treatment of neuropathic pain. These include several drugs in the tricyclic antidepressant class, such as nortriptyline and amitriptyline, as well as two specific drugs in the serotonin noradrenaline reuptake inhibitor, or SNRI class, duloxetine and venlafaxine. The mechanism of action of these drugs will be covered in much greater detail several weeks from now. But for now, it is important to know that the tricyclic antidepressants block the reuptake of monoamine neurotransmitters, including serotonin and norepinephrine, while the SNRI drugs have a similar mechanism of action where they block both serotonin and norepinephrine reuptake as well. Finally, there are a couple of topical products that can be used in the treatment of neuropathic pain, and these include a lidocaine formulation as well as a capsaicin formulation that inhibit specific ion channels to reduce the transmission of nociceptive signals in the body. Now is a good time to pause and review the mechanism of action of the analgesic drugs you've covered already in the integrated pharmacotherapy course sequence. These include the non-opioid analgesics or NSAIDs, specifically aspirin, acetaminophen, ibuprofen, and celecoxib, among others, as well as the anti-epileptic or anticonvulsant drugs gabapentin and pregabalin. For a good review of the non-opioid analgesics from Dr. Kurup, snap a pic of the QR code on the screen.